name's Dr. Fred DiDomenico of Elite Coaching, and I teach doctors advanced communication tools that takes a patient from "Doc, fix my back pain" through an emotional, transformational, decision-making process that inspires them to want to live their life differently with your spinal corrective programs. You know that chiropractic is a calling, and you have a vision that you want to fulfill. And one of the most frustrating challenges is when you're sitting there explaining an x-ray and you get that feeling that no matter what you say, they're not going to change their mind. They get stuck on their back pain. What's my insurance cover? And you know you can help them. You know you can change their life. Isn't that why you became a chiropractor? Because this is the best thing that healthcare has ever provided. Well, I felt that challenge too. And as a practicing chiropractor over 15 years, I joined several different management groups, but I was a postural corrective doctor. I wanted to change curves because I believed in the principle of chiropractic. Well, what happened was I could predict the correction, I could make that post-x-ray change, but I couldn't predict the commitment. So even if 7 out of 10, 8 out of 10 commit, who are you thinking about at the end of that day? That one person that walked out that you knew you could change their life. Well, you know what? I couldn't find some of those answers in chiropractic, so I went outside of chiropractic. I learned from professional communication coaches for over 10 years, became a professional life coach, read books on communication, and adapted a whole communication system of determining how do people make decisions, why do they act like that, and applied an emotional decision-making process that everybody needs to go through to get to empowered action, and applied that to spinal correction. The results have been life-changing. Over the last 8 years, I've trained hundreds of doctors, literally hundreds of spinal corrective doctors, on how to take people through that process. And you know what's happened? They come back from a boot camp, and after one weekend, the percentage of patients that now commit to care and pay go up or increase 30 to 40%. That's not atypical. That's what we expect. So those results have been phenomenal. Now, you know, it's not the Mercedes 80s with insurance anymore. We live in a different world. We went from an old world into a new world where insurance is getting worse. People are more cautious about where they spend their money. But you know what the great thing is? They want to be healthy. They have the money. They're willing to pay for it. Do you know how to reach them? Do you know how to take them through that emotional decision-making process? Well, in that new world, guess what? There's myths and there's truths. The myths are people just want pain relief. That's not true. The truth is they want health care. They're doing everything they can to get better health. You just have to show them why. There's a 5-step emotional process that you can learn that every person has to go through, and when you apply that to spinal correction, they want to change their life. You know what the most common mistake is in a report of findings? Showing an x-ray and explaining a subluxation. You wouldn't talk to a CEO the same way you talk to a stay-at-home mom before. You wouldn't talk to a car accident victim the same way you talk to somebody with fibromyalgia or an athlete. See, if you don't know how to talk to those people individually and you're explaining an x-ray, you may not reach them through that emotional process. So what's the first step? Well, we have 2 boot camps. We have a day 1, day 2 boot camp that takes you through communication, that takes them from "Doc, fix my back pain" into "I'm ready to change my life." Then we have a second boot camp that shows you how to get people emotionally committed to the life they want, your recommendations, take them through a financial so they'll find the money and give you the money to help them change their life regardless of their insurance, and then how to keep them into that chiropractic lifestyle. Those 2 boot camps take them from "Doc, what's my insurance cover?" into "I want to change the way I live my life," and actually following through with it. So the first step is call today. How many people have to walk out of your report of findings before you make that step? You can't find this anywhere else. This is a unique system with unique results, and I guarantee that your practice will change or you can get your money back. That's how successful it's been. Sometimes life is defined not by what you do, but what you don't do. Don't wait. Take action change more lives in your office today so you can fulfill that calling, your vision.